We started mitral balloon dilatations in 1986, and at that time we only had very long, large cylindrical balloons, like giant version of the coronary angioplasty balloon, and they were very difficult to work with. They were difficult to maneuver. After the first inflation, they never regained their shape. You often had to put in two balloons side by side to get big enough stretch area. And there was always a danger that if the valve resisted, they could shoot forward and damage or perforate the wall of the left ventricle and cause a major complication. So it was a great help when the Inouye balloon arrived, because this was a set of equipment which was specifically designed for this one task. You weren't making do with guide wires of the standard type. Everything was designer built for this task. And remarkably, they got it right first time, because that set of equipment we use today is the same one that we began using in the early 90s when the Inouye balloon first became available. And it made it a much more straightforward procedure. It gave you better control. Instead of with the old balloons, it was just one stretch size only. With the Inouye, you could grade the degree of stretch and limit, if there was any tendency to developing mitral leakage, limit the severity of it. So over the years, they made one or two little changes, and nobody liked them, and they went back to the original model. And of course, that has now become the industry standard. All of our interventional equipment is very carefully thought out and designed for what it's got to do. And so most of our patients now in Scotland, where acute rheumatic fever has really vanished, are much older patients. Our average age was nearly 60. And for this remarkable disease, we had patients who had had rheumatic fever in childhood, and they were now presenting with the narrowed mitral valve in their 80s. So for older people, being able to avoid an operation and improve their valve just with a catheterization procedure was a very big help, because many of these patients had become, in fact, inoperable. But I've also been doing valvuloplasties in Africa and India, and their patient set is totally different. They often patients in their young teens with very severe valves, and it works also extremely well for them. Usually their valves are better suited to a stretch because they're stuck together, the leaflets, but they're not thickened or hardened, and you get some tremendously good results in that young population. And in those countries which are economically struggling, the balloon can be re-sterilized and used again. So it can be used for, although it's relatively expensive to buy initially, for them it can be used several times, although of course only once in this country by law. The Inouye balloon is by far the most frequently used system for stretching the mitral valve. There are a few more other alternative models. One is a metallic dilatation device introduced by Alan Cribier, which is like the one used by the surgeons, but it's done percutaneously. And some of those cylindrical balloons are still used either as a double balloon fitted together, or the multi-track, where you can progressively advance additional balloons along the same guide wire until you've achieved the full stretch you need.